I'm going to let John, my son, go first and explain to you about our company. I want him to introduce our company to you because I think it's important that you know something about the company that you go to business with. So.
All right. This is going to be a little participation sport because that's how I do things. All of you know small business owners, and you know how the person that heads that company is basically the one that determines what that company is going to be like. The characteristics of the company, how they do business, how they follow up, how they take care of things. Is that right? It starts at the top. So I'm going to talk about our CEO. He's got awards this year for being the #1 CEO in the United States in all insurance, financial, and something else. A story about him will tell you how his part works, which tells you how our company works. Well, first off, we have 1,200 people out in the field selling. Our corporation is 11 people. We got 11 people running the entire company. Okay. Our CEO, he went and adopted a son in Russia. Son grew up here after a bunch of things went on, but in his heart was, you do the right thing. The young man went to the Navy. Happens to be, he was the first person in the Navy this year that was killed. Okay? But what Connor would do every payday, he would go and buy umbrellas. He would go around San Diego where he's at and hand out umbrellas to the homeless. And he would tell his dad, I'm doing it because it's the right thing to do, like you taught me. Troy infuses in us as a company, do the right thing. Like we said, like Mom says, hope is our baseline of our company. We have 4 things when we come out with any product. 1, it's got to be good for the customer. 2, it's got to be good for the salesperson. Because you know as salespeople, you got to be compensated. 3, it's got to be good for the company. Because if it's great for the salesperson and great for the customer, but horrible for the company can't keep doing it. And the 4th thing, it's got to be great for the shareholders. So every single product comes out has to go through that grid. Think of the corporations you've dealt with. How many think of the whole picture, or do they just look at what's best for the company? And that's what you run in corporate America today. Our company is run different. Our company is run that do the right thing, period. I came across 4 customers this week that I talked to that I let them know we're not for you. We're not the direction to go. And I helped them, I got online with them, and I got them where they really need to be. And it starts at the top. That's how we do things.
What I'm going to do is so that y'all understand what we have to offer, I'm just going to go through a regular presentation. Once we get through, if you have any questions, I'll be glad to answer them. Our company, the name of our company is U.S. Health Advisors, and we're through Freedom Life Insurance. We have basically 3 plans that we offer people. One of them is the 80-20 deductible plan that so many people's used to. That's not the plan that we sell most of the time. We have 2 other plans, and the other plans do not have a deductible. One plan is for people who cannot get insurance because of a medical condition, and it's called our Secure Access Plan. And the plan that we actually sell the most is called our Premier Choice Plan, and we only put people on that plan that's well. Now, if you're on 1 or 2 medications, we can get you on that plan. But if you're on 3 or 4 different medications, you've had a heart attack recently or whatever, we can't get you on that plan. That plan is actually the cheapest plan that we have, and it's the cheapest because there's only well people on it. Now, we are a member of an association, and our association works in conjunction with our medical products to enhance them and make them a better product for you overall. Our association offers benefits for the small business that's just going in business. They'll help you with your taxes. They'll help you with your HRA. And there's a counselor there all the time that can help you walk through things. Also, for your personal life, you'll have identity theft insurance. You'll also have emergency roadside assistance and a safety net child ID services. And then for your personal life also, you'll have accidental death and dismemberment on you and your family, the people that are on the plan. And if you go into the hospital, we'll give you up to $800 a day for every day that you're in the hospital after a one-day elimination. Now, that's money that will come directly to you because keep in mind, we basically work with small businesses, and we know that if those people are in the hospital, they're not making money. And as I go along, you'll see how we actually work to try to enhance the products for the small businessman. So that $800 comes directly to you. We're still going to pay the doctor, the hospital, the emergency room. That's your money to help you continue on. You'll have a plan that's called Call MD. And with that plan, if you get sick, and it's something you've had in the past, say sinus infection, bronchitis, ear infection, you can call, talk to a doctor, and they'll call you a prescription. So you don't have to get out and go to the doctor's office and sit there for 2 or 3 hours. We have emergency assistance if you're traveling and get sick and need to get back home. So that's just some of the products with our association that's offered to you. And then the Premier Choice Plan, and I'm doing this from memory, so I think I'm going to get everything covered, but I'm sure my coach over there will help me if not. You will have no yearly deductible. We start paying from the first dollar. Whatever the expense is, we pay from the first dollar. You can go to any doctor or any hospital of your choice. It's a PPO. About the only system that we know of in the Memphis area that's not covered is the Methodist Hospital, and they just changed their system, so we don't really know what it is right now. Just a minute, I'm going to have to open my book because I can't remember everything.
Well, Frankie, can I ask you something real quick? Because there's 3 minutes left. What is the ideal referral for you? If we could look for someone in particular for you in your business, that would be your bread and butter, your best referral, what would that look like?
Right now, the people that we're working with most is the people that are losing their coverage. Blue Cross and Blue Shield, you're losing your coverage in this area, and 2 or 3 counties outside of the Memphis area. Humana is only in 11 states. It's going up 40%. United Healthcare is going out of business. They're not going to be doing it anymore, as well as Golden Rule. Aetna's going to only do groups. And so these are people, if you haven't got your letter, you're probably not going to have coverage. And so our ideal people are those. But also, we like going in and seeing what you've got and going over it with you and do a comparison side to side. If we can't help you, we tell you, you're better staying where you are. But we've been able to help, I'll say 99% of the people we go in and talk to, we can help them. Because number one, you don't have a deductible. The plans that you're on that have been in the marketplace in the past, if you had a deductible, you had to meet that deductible before anything was ever paid, and then after that it was usually only about 50% of it that was paid. And one other thing, I'd be glad to sit down and make an appointment with any of you because we do not have one plan that fits everybody. We work with you individually on what your needs are and what your budget is, and we try to make them meet. Since I've only got about a minute left, as y'all know, with our presidential election we just had, Donald Trump plans on repealing and replacing Obamacare. That is not going to happen immediately, and the reason it isn't going to happen immediately is because whatever plan they put forward has to go through every state, every insurance commissioner's office, and has to be approved. Now he's wanting to do away with the orders, the state orders, and therein again the commissioners from each state is going to have to get together and agree on what can be done. So it will be almost a year, or probably at least a year, before any new plans is going to be able to come into effect. Is my time up?
You got 30 seconds. 30 seconds. But one quick question: what kind of turnover is it? So if someone has insurance and they're wanting to get with a plan like that you're talking about, what kind of gap or lapses is
Okay,
there?
what we do, we sit down and work with you and see when you want to go into effect. For instance, if you've got your premiums you normally pay on the 1st of December, you would like for this to go into effect prior to then, then we make every effort for it to go into effect within that period of time. Here, within the last week, we've got people approved in 3 or 4 days, especially if they're on our Premier Choice plan, where you don't have a lot of medical records that have to be full. So we can usually turn you in fairly quick time.
Have you had anybody come to you with a small business with 50 to 200 employees and say, hey, we're just planning on discontinuing our health care coverage as a company benefit, but we do want to bring you in and have you individually assess everybody to try and save them money because these group plans are being charged so much for the people that are unhealthy in their group?
We only usually work with about a maximum of 50 people, but
Okay.
we do try to work with people otherwise, so we would make every effort to accommodate you.
Interesting.
What about companies that have traveling salesmen that go abroad? Do you work with them?
We only cover people, like most companies, about 30 days outside the United States.
30 days outside?
Mhm.
Is that one continuous time, or is that every-day combination?
Is it continuous 30 days? at a
So if
time?
they go out, let's say the month of May, they're out of the country, they're still covered for that month of May, and they come back, and in September they go again, they're still covered.
Okay. And then what about subcontractors?
I don't know.
Subcontractors such as Chris and
Kevin.
Kevin and
Ongoing
Are you asking
business.
if we cover them, or what are you asking me?
either way, because a lot of subcontractors, it's usually just 1 or 2 or 3 employees.
Oh, we
That are
cover,
not-
we cover everybody individually. We don't just go into a company and just, because everybody is individually. We work with everybody individually.
That's why I asked how many people, because they're not a group, right?
Right.
Yeah, yeah, it is.
Thank you so much.